Good afternoon. My name is Gervan Fearon, and I'm the president of George Brown College. I'd like to begin by acknowledging that George Brown College is located on the traditional territories of the Mississaugas of the Credit First Nation and other Indigenous peoples who have lived here over time. We're grateful to share this land as treaty people who learn, work, and live in this community with each other. It is my pleasure to welcome you to George Brown's waterfront campus. In particular, I would like to extend a warm welcome to our special guests, the Honourable Rod Phillips, Minister of Long-Term Care, and Effie Triantafilopoulos, who is the Parliamentary Assistant to the Minister of Long-Term Care. I would also like to recognize our students who are here with us today, our personal care worker students who are joining us. For over 20 years, we have been preparing Ontario's PSWs with the workplace readiness skills they need to succeed. Throughout the pandemic, we have all seen that essential role played by PSWs, and this role in terms of caring for seniors, people with disability, and as well vulnerable populations. But we've also recognized and we've heard about the crucial and critical staff shortages. To ensure that our students gain critical training at a time when they are needed, we're launching and have launched a number of key initiatives. We've developed an innovative approach to PSW education, in particular with the Reiki Center. Our blocked placement residence model allows PSW students to gain hands-on experience in long-term care facilities so they have the skills and experience to enter the field immediately and to succeed. We're also particularly a part of the efforts by Ontario, and this is the efforts to ensure that the largest recruitment and training drive takes place in the province. And therefore, we're thankful to the investment made by our provincial government and by the minister as well. And in fact, this has allowed us to accelerate the tuition-free PSW program, which has enabled us to train approximately 80 new PSWs, in addition to the more than 100 students who graduate from our regular program each year. To help improve the quality of care for seniors, we've also launched a first-of-its-kind interprofessional complex and long-term care program that's a postgraduate program for our students, specifically designed to deliver and to be delivered online. And through this program, we've also augmented it with simulation programs, problem-based learning, to ensure that our students are gaining the skills they need to contribute to long-term care and to be long-term care providers. We've also increased the capacity of our Bachelors of Science in Nursing and Practical Nursing program, thanks to an investment by the province, and we thank the Ontario government for their support and their assistance of George Brown. This initiative, in fact, will add approximately 1,130 new practical nurses and, as well, 870 registered nurses into the healthcare system, an outstanding achievement for the province and for the college. On behalf of George Brown College, I would like to applaud the provincial government for the support of the next generation of personal support workers, nurses, and other healthcare professionals. We look forward to the continued work and continuing to work together in support of our students to help our students achieve their career goals while providing the essential workers Ontario needs to keep our communities healthy and strong. Now, it is my pleasure to welcome Effie Triantafilopoulos, the Parliamentary Assistant to the Minister of Long-Term Care. Thank you so much.
I would like to begin by thanking George Brown College for hosting us today. The college provides high-quality, hands-on education for its students, training to be personal support workers. We had a chance earlier today to visit the learning labs and see this great training live. Personal support workers are the backbone of long-term care, and Ontario needs PSWs now more than ever, across the healthcare system and especially in long-term care. That's why our government announced our Ontario Long-Term Care Staffing Plan last December. Through this plan, we are investing $4.9 billion over 4 years to help create at least 27,000 new positions for PSWs, registered nurses, and registered practical nurses in long-term care. It means thousands of new jobs at long-term care homes across our province for people like the PSW students studying here at George Brown. Our plan was based on a staffing study we conducted with a panel of experts in the field, which I was pleased to take part in as parliamentary assistant. Today, we are here to talk more about our historic staffing plan and our plan to fix long-term care and to ensure Ontario seniors get the quality of care they need and deserve, now and in the future. To speak about this, I am so pleased to introduce Ontario's Minister of Long-Term Care, the Honourable Rod Phillips. Thank you.
Thank you very much, Effie. In addition to being a great representative of our constituents in Oakville, North Burlington, Effie Triantafilopoulos has been an advocate for long-term care residents since taking on this role in 2018. It's just so great to have you on the team. Thank you for that. And it is great to be here at George Brown College. Thank you very much for hosting us today. Thank you to the PSW students, Adrian, Shanti, Rachel, Natasha, and Ronan, who gave us all a tour of the PSW lab. It is also great to be here with George Brown's president, Dr. Gervan Fearon. Dr. Fearon, it was great to see the work, the expansion of the campus that's going on. George Brown has been a critical partner of the people of Ontario. Thank you for that. After decades of neglect, our government continues to take action to fix Ontario's long-term care sector. We have a plan to fix long-term care and to ensure that Ontario's seniors get the quality of care they need and deserve both now and in the future. Our plan is built on 3 pillars: staffing and care, accountability, enforcement, and transparency, and building modern, safe, comfortable homes for our seniors. Seniors entering long-term care today are older and have more complex medical needs than they did just a decade ago. The level of care residents need has increased dramatically, but unfortunately, the amount of care they receive has not kept pace. In the 9 years between 2009 and 2018, the amount of care each resident received per day increased by only a total of 22 minutes. In the 2020 budget, our government committed to ensuring residents receive, on average, 4 hours of direct care per day over 4 years from nurses and personal support workers. That means a daily increase of 42% of care, or an additional 1 hour and 22 minutes of care over just 4 years. This will make Ontario the leader in quality long-term care in Canada. To make this a reality, tens of thousands of new staff are needed, as Effie said, and they need to be hired, and of course that can't happen overnight. That is why I'm here today, to announce that we are providing an additional $270 million this year, beginning next month, to long-term care homes across the province to increase the number of personal support workers, registered practical nurses, and registered nurses. This investment will allow all homes to hire and retain the staff they need to increase daily direct care so that we can meet the annual goals set out in our staffing plan. It will support up to 4,000 new long-term care staff across the province. To ensure that these funds are only being spent on hiring much-needed frontline staff, ministry officials will audit the home's expenditures. Residents currently receive, on average, 2 hours and 45 minutes of daily care from nurses and PSWs. This funding I'm announcing today will increase the daily average to at least 3 hours per resident per day by the end of March. But beyond that, our commitment continues. In addition to this year's funding of $270 million, we will be increasing investment each year, and by 2023-24, we will be investing more than $1.82 billion in additional base funding for staffing each and every year. Over the next 4 years, along with the investments we are making to train and educate more PSWs and nurses, that's $4.9 billion extra dollars for staffing and care. Now, what's truly important is what this means. This year's increase for a typical 160-bed home means $1.2 million more over the next year in funding for new frontline staff. By 2024, that same 160-bed home will receive an additional $3.2 million more than they receive now for PSWs and nurses. And that means that that typical 160-bed home will have an additional 6 registered nurses, an additional 12 registered practical nurses, and an additional 25 personal support workers. Now, that does mean jobs for people like Adrian, Shante, Rachel, Natasha, and Ronan, and for nursing and PSW students training across the province. But it also means more quality time for staff to spend with residents, and that means an extra bath, more attention at meals, or just time to chat. This funding also includes $42.8 million to help increase care provided by the critical allied care professionals, such as physiotherapists, dietitians, and social workers, and that will increase by 20% over 2 years. This increase in staff support to resident care has been championed for years by residents, families, and advocates. I want to thank all of them for their passion and commitment to improving the life of our seniors in long-term care. Now, to ensure that residents receive this care now and in the future, we are going to make the requirement to provide an average of 4 hours of direct care per resident per day the law when I introduce legislation this fall to reform long-term care. Improving care for residents is a key part of our plan to fix long-term care. Not only are we making historic investments in staffing and care, we are providing a level of funding certainty to homes that they've never had before. In the next week, each home will receive funding allocations for these additional investments, not only for this year, but for the next 3 fiscal years as well. This is to help them plan and bring a measure of staff stability to each and every one of the homes in Ontario. This kind of multi-year commitment is unprecedented in the history of our province. It's the kind of commitment that's needed to make real, lasting change. And it's the kind of commitment that's needed to fix long-term care. Improving staffing and care is the first pillar in our plan, and also important are the other 2 pillars, which is having enough safe, modern, comfortable beds for seniors to call home, and strengthening accountability, enforcement, and transparency in the long-term care system. As you heard this week in the throne speech, we've committed to build 30,000 net new beds this decade, and we're making good progress. In total, we have over 20,000 new and 15,000 upgraded beds in development, more than 60% of our goal. Building modern, safe, comfortable long-term care homes is an important part of our plan to fix long-term care. As we head into the fall legislative session, we are also moving to improve accountability in the long-term care sector to ensure residents get the care they deserve. Our plan will give us the tools to hold home operators accountable. Improving oversight and transparency to restore trust in long-term care is an important part of our plan to fix long-term care. Our government is fixing the long-term care system so that Ontario's homes have more staff and residents receive a higher level of direct care, the care that they need and deserve, so that they can experience the best quality of life. We have a comprehensive plan that's going to make this happen, and I look forward to the opportunity to talk to you about it. Thank you, and I'd be pleased to take questions.
We'll start by taking any questions from the floor. There being no questions, we'll go to the phone line. Just a reminder, it's 1 question, 1 follow-up. First question.
Also a reminder to press star 1 on the phone if you have a question. First question will be from Nicole Lempa at CTV News Kitchener.
Hi, Mr. Phillips. Good afternoon. The OPP have charged a 22-year-old PSW with voyeurism for taking and distributing intimate photos of a vulnerable resident at a long-term care home in Guelph, Aramasa. What is your reaction to that, and will this spark an inspection at the home?
Well, nothing's more important than the safety and caring for our residents in long-term care, and of course the reports are very upsetting. Now, it is a matter that the police are dealing with, and so, as you can appreciate, the right authorities are involved, and of course, ourselves and the home will cooperate in that regard. But no one can hear that story without being very upset by it, and it's important that we let the legal authorities take the steps they need to follow up at this time.
Follow-up?
There are calls by senior care advocates for more transparency for reporting and mechanisms to prevent these types of abuse. What is your ministry going to do to enhance background checks during this recruitment and training drive? And can this possibly be done at this time when the sector is so desperately in need of healthcare staff because of the pandemic?
Of course, it's essential that the people who work in our long-term care homes are of the highest quality, and that is an important thing that the ministry and, of course, colleges like George Brown and others will take into account. One of the areas of focus for our legislation in the fall is very much the issue of transparency and accountability. So that's something that will be a focus of the legislation. As I said, with regards to the specifics, however, the police are handling this case, and we have to let that process unfold.
Next question.
From Rob Ferguson, Toronto Star.
Hello, Minister. I'm wondering if you believe that this $270 million is enough to allow nursing homes to hire more full-time people. The problem, as you know, has for a long time been that a lot of these jobs are part-time. People work 2 or 3 jobs. It doesn't help the situation. It leads to people hopping between homes and perhaps spreading infections as well. So how is this going to come into play here?
Thanks for the question, Rob. I have been having the opportunity to visit many homes and speaking as well with students here today, as well as other students. And you know, we understand that there needs to be a certain amount of flexibility when it comes to the operation of homes. But I believe it's time, given the massive increase in funding, 43% increase in funding that the government is providing to home operators, that they look very seriously at the role that full-time employees play. Obviously, we need more nurses. We need more PSWs. We need more staff members, and they need to want to work in an environment where they feel appreciated. So I think this is an area that the home operators need to be looking at, and it is one of the opportunities, because of the $4.9 billion investment we're making, that they can make to look seriously at how they allocate staffing and where full-time and part-time staff really make sense.
Follow-up?
All right, and how much do you, Minister, do you have an idea what the ratio, like, do you have a target ratio you would like to see for full-time, part-time?
You know, I've asked PA Triantafilopoulos and my deputy minister to chair a table that's going to include operators as well as members from the major unions, the major industry associations, residents and family representatives. When it comes to staffing, we are making this investment today, and we're putting those dollars out immediately. We want the money out next month so people can start staffing up, but this is a multi-year program. So that's one of the questions that I've asked that group to look at. What are the right ratios? We need to make sure that there's flexibility in our system so that long-term operators can operate their homes. But it is one of the topics that I've asked MPP Triantafilopoulos and my deputy minister to take on with that table and give us some advice. Remember, this is a situation that took decades to get to where it got to, and it's going to take us the full 4 years to train up all the staff and get them deployed. And we're going to keep learning throughout that period, and we're going to look at what the ministry needs to do. But I would encourage the operators to look at what they do. They know a lot about their homes, and they know what the right mix of staff would likely be.
Next question.
From Holly Mackenzie-Suter at the Canadian Press.
Hi, Minister. I wanted to ask about the issue of wage increases for PSWs. I know that was done temporarily during the pandemic, but I just wanted to hear from you if you are considering making that permanent, especially to make these full-time jobs more attractive to employees, and if that consideration about wage increases was factored into this funding at all.
Yeah, Holly, we of course have increased wages first with pandemic pay across the long-term care system, and then with the targeted $3 per hour increase for PSWs. As the Premier said, we're going to make sure that the wages are commensurate with the great work that these individuals do. So that is something that we're working on, and of course, in all of our considerations, we've thought about what that would look like. We need to create a workplace and a work environment where people like the great folks behind me want to not just spend a few years, but spend a career, maybe work their way from PSW. We were talking before about people being interested perhaps in becoming nurses and other professions. We need to create what they call at places like George Brown a career ladder where people can move from place to place.
Follow-up?
Thanks. Yeah, follow up. I'm just wondering about the vaccination requirement that you announced last week, and several other companies are already implementing that. I mean, it looks like there's going to be a lot of training involved for this funding to really have an impact. So I'm just wondering kind of what you're thinking about the potential kind of pretty large gap in employees and staffing that could be coming up in the next couple weeks as some people lose their jobs over that.
Yeah, so we've been working with the operators, obviously with training facilities and both private and public, like here at George Brown. We expect 11,000 PSWs, like the ones graduating behind me, to come in to the workforce between now and the end of the year. 17,000 by the end of March, and we have a number of other tools in place to support homes. With regards to the decision around the vaccination mandate, we were making progress towards. We have approximately 9 out of 10 PSWs and other staff members inside homes vaccinated right now. But when we're dealing with our most fragile people, when we're dealing with our elders and our seniors, we need to make sure that's better. And that's why we made the decision. Obviously, it's not until November 15th. I'd encourage, well, first I would thank all the tens and tens of thousands of people who work in long-term care who've gotten a vaccination. Thank you so much. And for those who haven't done it yet, I know how much you care about your residents. I know many of them. I was with a group yesterday, described them as family. Very important that you get that vaccination, and we hope that you will.
Next question.
From Scott Laurie, Toronto Sun.
Minister, thank you very much for taking the question. There's a home in Toronto, a Copernicus Lodge, which they say that they're losing 36% of their workers because they have not been vaccinated. That's as of yesterday. What do you think you can do for a home like that that's losing so many people all at once?
Yeah, first of all, I want to commend the CEO and the board at Copernicus Lodge. When they made the decision back in September, before the province set a mandate in place, but to do that, they started planning at that time, and they've been working with the ministry, with Ontario Health as well, to make sure that the 220 beds that they have there are fully staffed. They were also, though, in the bottom 10 homes. When we look across the province, on average, we're seeing about a 90% vaccination rate. Copernicus and a handful of others had lower vaccination rates, under 70%, and so they face a particular challenge. So we have a number of ways of supporting them. They've been in touch. I know the CEO has spoken directly about the fact that they have staff in place now. They have a particular challenge there because of the Polish-speaking population, but they've been able to find Polish temporary-speaking staff, which is great. But we'll continue to support those homes. For the majority of homes, many of which I've visited, the reason that they are very supportive, and they have been almost universally, of this mandate is that although there are a limited number of staff who won't get vaccinated, despite everybody's requests that they do, the much bigger risk from a human resource perspective is losing 12 or 24 people because of an outbreak. That is what's very difficult for a home to handle. So with Copernicus, we've been working with them, and I know they've made their plans. And I know with the majority of other homes, they are making the same kinds of plans.
Follow up.
If they're close to the bottom of the list in terms of staff that are vaccinated, could that put them at the top of the list when it comes to this extra staffing that you're announcing?
Of course, staff will go where the good environment to work is. But I'm sure, and I actually was mentioning it to a couple of my friends back here. I was encouraging them. I think we have somebody who's graduating in the next few weeks. So those are the benefits of the fact that working with George Brown and other colleges, we started this program when we did. We paid tuitions, and we now have graduates coming out. But obviously, I think with those new PSWs coming on, they're going to want to go work in the homes. I think they are reassured, as the folks I talked to today, by the fact that the homes they work in will have staff that are vaccinated and that are safe, so that they can focus on caring for residents.
Next question. This will be the final question.
From Laura Stone, Globe and Mail.
Hi, Minister. I just wanted to go back to the question about permanent pay raises. I didn't quite catch your answer. So is the government doing that, or did you say you're just looking into it? I just hope you can address the issue of maintaining staff. We've heard so much about staff turnover in this industry. So what is the government going to do to actually make this a desirable place to work, seeing as everything that we've seen happen during the pandemic why would people want to jump into long-term care, and what are you doing to ensure that they stay?
Well, let me tell you the answer I hear from people like the students behind me, and it's about wanting to make a difference and wanting to care for people. That's the motivation. And so we have to make sure that the places that people work and the work environment is one they want to be in. With regards to the pay increases, again, we've extended a number of times the temporary pay increase. The Premier's made it clear that we will continue to make sure that PSWs are paid at a rate that supports the vital work that they do. But there are other factors as well that are very important. A safe work environment. That's why the vaccination policy and the mandatory vaccination policy is so important. The kinds of new homes, we have 220 projects going on right now, new and redeveloped homes that are going to be beautiful places to live for our residents, but also great places to work. There's a number of other steps taken in terms of professionalizing, for example, the personal support worker profession and other things to make sure that this is the kind of profession that people want to undertake as a career. So there's a number of steps. As I've said, it took decades to get the long-term care system to the situation that it's been in, and it's going to take some time to fix it. But I guess I would end up with what I talked about in the announcement today. The number of new staff. When I go into homes and I talk to the staff and I talk to the managers and I talk to the residents, the number one thing that they ask about is, can we have more staff? The staff make the difference. So we're talking today about a 43% increase. And as I talked about in that one example, dozens of staff in just one home. That's going to make the work environment more appealing, and that's going to, we hope, continue to attract the kind of talented people that I met today.
Follow-up?
Thank you. And long-term care and your upcoming legislation was one of the only concrete specifics contained in this week's throne speech. Can you talk about how important this is for your government, what role you think it will play in the upcoming election, and if there's a recognition that this industry or this sector was not well handled during the pandemic, and what you're doing to make it right now?
I think that everyone who has read the Commission report or any of the number of reports has seen that long-term care has been a problem in this province for a long time through many governments. And so we have committed to do the things that are needed to fix it. An important part of that is going to be the legislation that'll be bringing forward. The legislation particularly is going to focus on three things: accountability into the sector, making sure that enforcement is at the level and of the nature that we need, and transparency, which has been very critical and came up in an earlier question today. That, along with making sure that we are providing the staff support, thousands, with this one investment, over 4,000 more staff, 27,000 more staff over the next 4 years, and then, of course, facilities. We have those 220 projects underway right now across the province, providing safe homes for our seniors to live in. So this is an important priority of the government. That's why it was focused on in the throne speech. And again, we'll continue to highlight this area. We'll continue to need to work with partners, whether it's on the labour side or within the operator community, among families, among residents. There is incredible goodwill to fix long-term care, and we're going to make sure it gets done.
Thank you, everyone.
Thank you very much.